Hey guys, I'm Katelynn Griffith, and Miss Hand has asked me to answer a couple of y'all's questions, and so I'm going to be looking back and forth from the questions and the screen. So, first question. Once again, I'm Katelynn Griffith. I am a junior nursing major here at Troy University, and I'm 20 years old. And I graduated from Huntsville High in 2018. Woo. I also am a Troy cheerleader. I'm also in a sorority here at Troy, and I was in Miss Hand's class my senior year, and I was also co-president of HOSA. So, okay. So once again, I'm in nursing school. So I just got into my first semester, and I don't know if y'all know the way that nursing school works, but you'll do 2 years of your undergraduate studies. So your studies like English, history, science, math, all the fun stuff that you already did in high school. So, but they are still important to do because all those courses that you have, that makes up your GPA to apply to get into nursing school. So they're very, very important. And then, let's see. What do you hope to eventually become? So my plan is, after this 2.5 years of being in nursing school, to graduate. That's the plan. That is step one. So then step two would be to go work for a couple of years, probably about 2 or 3. And then I want to go back to school and get my nurse practitioner. So a nurse practitioner really is someone who's kind of under the doctor, like a right step below the doctor, but above the nurse. And then kind of the same thing as a PA, if y'all have heard of a physician assistant. And so that would be my next goal after working for a couple of years. I really want to be a labor and delivery nurse, and that would be my goal to specialize in. And so I've recently been told to go work in ICU or med surg to get more of a background first before you go specialize. That way you're kind of well rounded in all areas, because those are very high intense, fast paced fields of study and that your patients come in. And so that's what I might end up doing. I'm not really sure, but those are the plans. So a day in my life, how does it look like? So every day is a little different, but for the most part, I go to class for a couple of hours. I have some classes that are 2 hours, some that are 1, and then I have a class that's 3 hours. So it kind of just depends on what day it is. So I'll go to class, I'll grab some lunch, go back to class, and then I get home and I kind of set up my planner and I figure out the week and I organize my calendars and all that. And I make sure I have everything written down, and then I look at the day and see what's due. I look at the week and see what's due and I need to get started. And then I'll kind of just chill out for a little bit, and then I'll have cheer practice at night. And then I also forgot to mention that we have workouts. So usually those are at like 6 a.m. in the morning. So those are super early, but it is nice to get it out of the way. So I saw a question about, let's see. Oh, where'd it go? Oh, do I find myself having free time? So the answer is no, but I also do a lot more than what a regular student would do. So like I said, I cheer, I'm in a sorority, and I just got into nursing school. So nursing school is live, eat, and breathe. That is what they want us to do. They want us to never stop thinking about nursing, and that, honestly, I've come to find out is just the way that nurses are these days. So not everyone's going to cheer, play sport, and be in a sorority. So that kind of is just like a personal preference. Coming in, my parents were like, okay, you're doing way too much. But I was like, no, I have to stay busy. Like, I need stuff to do. Like, I want to be involved. And for me, I have gotten more out of Troy University and my college experience being involved. So I really highly encourage being involved outside of just your school. not now school is my first priority without a doubt. So that is really what I focus on, and then I'll go to cheer and then sorority. So that's kind of like my list of my priorities. But it is possible. Don't be afraid to get out there and try new things and be involved, because that really is important. So, because you only get to be in college for about 4 years, sometimes 5, depending on what it is. So, and you really want to enjoy it while you can. All right. What is one thing you wish you knew before going to nursing school? Okay, so in general, before going to college, I wish I had known that it is just a whirlwind of surprises and being challenged. So coming out of high school, I know that we're all excited to go to college and we get to be away from your parents, and it's your first time by yourself and there's no rules and all that fun stuff. So that's great, but it takes time to adjust. So for me, Troy is 4 hours from home, so it wasn't like I could just go home every day and go to my parents' house, or even on the weekends, if I go home, I have to stay the night because it's such a long drive. But that was okay with me because Troy just felt like home, and I knew that's where I needed to be. So that's really important. But there's challenges every day, and you just have got to learn to push yourself and work hard through those challenges. I personally like to be challenged on a daily basis. I don't like to be bored and not challenged and doing the same thing every day. And so for me, I think that's something that I was very not hard to adapt to. I kind of adapted to it a little bit easier. But I will say I wish I would have known to, I guess just that college is always something new. So, put yourself out there. It's okay to take risks. You're really going to find out who you are. You meet new people. You move away from your friends. And so that was kind of hard, but you will meet people and you will find your kind of like connections. And, but yeah, so just, it's going to be a bunch of uphill battles. There's going to be great days. There's going to be okay days. And there's going to be days where you wish you could just lay in bed all the time. But that'd probably be my best advice, is just keep pushing and always be up to new challenges. So, but for nursing school, I had a pretty good background being in Miss Hand's class. So for me, it wasn't that I didn't really know what I was getting into, but that of having that good background. So I will say Miss Hand's class prepared me very well. And just an example, so we were doing bed making skills and concepts, and my professor had asked the class, when you make the bed, there's a little triangle fold that you make, and I can't remember the name now, but Miss Hannah taught us this, and she said, does anybody know what this corner fold is? And I raised my hand and I was like, oh my gosh, I know what it is. And so that just kind of like reminds me of an example of how Miss Hand's class has prepared me to do those skills and not just going in blind and not knowing what anything is in the nursing field. So that has been a big help for me. So I'm not a pre-med major, but I will speak off of my friends that I know that are pre-med. It's doable, don't get me wrong, but it's hard. So before you even get into med school, these courses you take, especially starting into your junior and your senior year of pre-med, are very hard. Now, I know for a fact, one of my friends that I'm really close to that went to high school together, she was pre-med and she went to Alabama. And she went through the first 2 years, and then she realized, okay, this is not what I want to do. I don't want to be 8 more years in college. I don't want to just, get medications and see a patient. Like, I want to be more involved, and I want to get more for what my time that I spent learning about. Not saying that doctors don't do that. I'm just saying that's what she kind of wanted to do more. And so now she actually just transferred to UAH, and she's changed her major to nursing. So there's different routes. Pre-med's hard, but at the same time, it is doable. I know people that are still in pre-med and that are about to graduate, and they're going to go off to medical school. So it is very doable. It just is really hard, and it's a lot of schooling. So you have to be dedicated, and you have to love that side of the healthcare field. That's a lot of your sciences, your chemistry, lot of science. So that's for pre-med. Did I ever doubt my profession? So no. So I kind of knew I wanted to be a nurse going in, or go to nursing school going into my junior year of high school, right after that sophomore year, when everything, you have to start applying for your ACTs and start applying to colleges. And so I kind of wanted to figure out what I wanted to be. I had started off wanting to be a doctor and go the pre-med route. And then after looking into it and seeing how many years it took to become a doctor, I had changed my mind and I said, nope, that's not for me, because I know personally I could not go through 8 years of school. So I thought, okay, well, what about nursing? My cousin's an ER nurse in Texas, and she's kind of my role model for me for that. And she had always told stories, and so I had just kind of gone off of that. I thought, okay, well, let me look into nursing. And so I looked into nursing, and I kind of realized, okay, this is kind of what I want to do. I've always had a heart for caring for people and wanting to do what's best, and I like science and math. So I was like, all right, this is all kind of coming together. And so then I started looking into nursing schools, and that's how it led to Troy. And so, and then after, it had kind of been confirmed for me when I had hit my senior year and I started going to the hospital in Ms. Hand's class, and I was able to step foot in the hospitals and see how it all worked. And that's when I think it really confirmed for me that I did want to do nursing. So that's kind of when I decided I wanted to be a nurse, and I never really doubted it, just because I always have a high look on nurses. I've always had great nurses take care of me and my family members. So I think I haven't really had any second thoughts or about nursing. So what is your favorite course? So undergraduate wise, I'd probably say anatomy 2 or patho. So anatomy 2 is more about how the body works and why it works and why it does the things it does, and the chemical reactions, and not like chemistry, but like the reactions and through the body, and why you sweat, why you're thirsty, things like that. There's different chemoreceptors, all this kind of cool stuff that happens in the body that we don't even know about on a daily basis, that our body just does it because that's what it knows how to do. So I think that is really cool. And then I'm in first semester of nursing school. So I think right now the classes that I'm taking, so I can give a little bit of a rundown about that too. So once you get into the program, your first semester, it kind of depends on where you go to school, but still look a little different. But for the most part, you'll be in a concepts class, and that is pretty much what it says. It's the concept. So it's your basic starting out level of nursing. So you have a lecture, and then you have a lab for that. So for the lecture, you learn about all the skills, you learn about why you're doing these skills, and then you learn about the science behind it, so like the patho behind it, and just kind of like the reasoning and the kind of like how the body works again behind why you're doing what you're doing. And then in lab, you get to do hands-on. So some of those hands-on skills that we've done has been bed making, hand washing, restraints, giving baths, bed baths, Foley catheters, wound care, and then we just did trach care and trach suctioning. So a bunch of cool stuff that is very important, but those are the bases kind of for nursing. So that's what nursing concepts is. And then we have health assessment. So health assessment is, say a patient comes in and you'll have to do a head-to-toe assessment of every body function system that there is. And so that is really cool because, and it's very intricate, because you have your whole human body to go over and just figure out what is wrong with this patient. And so I like that because it's kind of like problem solving, like figuring it out. Because your patient can give you details about what is wrong with them, but then when you have to look at them and compare what they said to what is actually wrong with them, I think that is very interesting. And you're trying to figure out what's wrong. Like the patient might come in with symptoms of redness, swelling, and itchiness, but like, okay, but where at, why? And then you have to figure out why, what is the body trying to do, trying to get rid of, that is creating these symptoms. And so I really like that because you have to think critically and you have to problem solve to figure it out. So I like that class. And that also, so like that's a head to toe assessment. So starting with your hair, like inspecting your scalp, inspecting your skin, looking at your client's eyes, looking at your client's nose, your mouth, like things that a nurse has done to you, but maybe you just haven't thought about it. Like when you stand far away from that eye chart and you have to read, like you'll learn how to do that in this class, to take vital signs in this class. You have to listen to clients' lung sounds, and you have to see if there's something abnormal, or like it's just a bunch of cool stuff that I really like. So there's that class, and then there's dosage. So dosage is like medications and the math behind medications. So it's not really like pharmacology where you're learning the names of these medications and how they work. It's more of you're given an order, like a prescriber's order saying give this much medicine to a client, and then you go get the medication, and then you have to like compare it and see what math you have to do to get it from milligrams to grams and all this kind of like fun stuff like that. And so I like that just because I've always been blessed to be good at math. And so I enjoyed that class. And it's interesting because you talk about like needles and shots and IVs and insulin and heparin, like all this fun stuff. So, but you don't actually get to do IVs and needles until next semester. So, but that's like the basis behind that. And then there's, I'm trying to think. That's perspectives. Okay, so perspective is kind of like teaching you how to be a professional nurse. So there's so many do's and don'ts that you would have never known about nursing, and the do's and don'ts of an everyday nurse from that 12-hour shift from start to end. And that really is what perspective is about. It's kind of starts off with like the history of nursing and how nursing got started, and then like society's view of a nurse, and then the research behind a nurse. So that's really perspectives. And then you just have the health assessment lecture and lab. So that, and then there's pathophysiology. I took that before I got into nursing school, but you can take it before or once you're in the program, depending on what college you go to. But patho is like the disease and the disorders of the body, and telling how you look at a patient or what's something that's wrong, or lab values, and then knowing like, okay, well, this is wrong, so why is it wrong? And then what disorder is this like compared with? So, and then one thing I've learned recently is that nurses cannot give medical diagnoses. So, and I had no idea that this was even a thing, but it's really important because I've noticed that right now with everything I'm doing, that I can't diagnose a patient. And so I think that's a big misconception, is that nurses, we can't sit there and say, well, you have COPD because you're having trouble breathing and there's an obstruction and this is chronic, and so you have COPD. I can't tell a patient that. And so that is something that has kind of shocked me. I didn't know that coming in to nursing school, but instead, like a nurse can be like, okay, well, you have inflammation, you have a mucus buildup, this is chronic, so therefore those are your symptoms, and let me treat those symptoms. But like a doctor can go in there and say, okay, you have COPD. So that was something that was very interesting to me coming in, and very important to understand, especially once you realize that, and once you're being taken care of by a nurse. I think that gives them a little more respect of their time and what they're doing to try to help you and what their field of scope is. So, do you think it is manageable to study nursing and still have a work-life balance? Yes. So last semester I had a job. I worked at a daycare, and I worked the afternoon shift at the daycare because it was an all-day daycare, and I was fine. Like I didn't have issues. I'm really good at time management, and you'll learn those skills coming in. I think about after the first year of college is when I really had good time management skills, because you're kind of into routine. You're kind of used to how it works. You're familiar with your surroundings. And so I think that is definitely doable. Like I said, I cheer, I'm in a sorority, and I worked last semester. I'm not working right now just so I could spend more time on nursing school and make that more a priority. Time management is the biggest thing. It's definitely doable. I know I have some friends right now in nursing school with me that work also. Now they're not in a sport or they're not in a sorority, but they just go to school and they work, and that's what they love to do, and that works great. So it kind of just depends on your personal preference. What has surprised you the most about working in healthcare? So it's just not. I guess not what I don't want to say. It's not what I expected, because I mean I was in the healthcare like clinical setting, and I did know what I was expecting, but it's just a very different way of thinking. So the way that a nurse thinks on a daily basis is so different from how me and you think right now, like before I got into nursing school. So like when you get into nursing school, they teach you critical thinking, problem solving skills, and the way to think about like nursing care and nursing plans and stuff like that. So it's just a completely different way of thinking. And it just takes time to get used to. Like I'm still getting used to it. I'll still get back some assignments that say, you know, well, what about this? Like, and I'm like, okay, yeah, you're right. Like, you know, that is a way, like that's a different way of thinking. And so all the instructors are really great. They really do want you to succeed. Now, they're not going to do the work for you. They're not going to make it easy, but they will say like, hey, well, what about, have you tried it this way? Or, well, why are you doing that? Like, why, you know, they ask that question, why? And so that's a very important thing for me. But I don't really think I found anything surprising about working in healthcare. And I haven't actually, per se, like worked and like have gotten paid for working in a healthcare position. So I don't really know all the ins and outs yet. But I will just say the way that medical professionals think, and the way that a normal, I mean not normal, but just regular other individual thinks is completely different. So that is very interesting to me. So what kind of person would you recommend to study nursing? Okay, so this kind of reminds me of my essay I had to write to get into nursing school. So the characteristics I would give to somebody that maybe wants to apply to nursing school is, one, you have to care. Like you have to have some kind of passion, some kind of want, need to give your heart and your skills the best that you can. And so I think that's the most important, because if you just don't care like about giving providing nursing care to patients and wanting the best outcome for your patients, then what's the point? You know, you're not going to give your clients the best patient outcomes, and you're not going to want to see your patients succeed, and it's going to be just not a good situation. So for me, I'd always say that, you know, putting your heart out there the most you can and giving the best, providing care that you can. And then I would say also hardworking. You've got to be hardworking. Nursing is not easy. Now, nursing school is not easy either, but that's because nursing, like an RN career, is not easy. So, and there's a reason for that, because, you know, with the advancement of healthcare these days, nursing school really has had to up its curriculum, because now you have patients coming in with not only one chronic disorder or disease, but now you have four. You know, they have four different ones. And then, you know, there's a nursing shortage, and that's another thing is that, but the nursing shortage, there's always a need for nurses. So you're always going to have a job. There's always job security. I mean, with COVID, when all the other jobs were shut down, I mean, the nurses still had a job. They were still caring for their patients, you know? And so there's always going to be a need for nurses. That's why there's always going to be a nursing shortage. And so, because there's increasing amount of people are living longer. There's more medical technology to help these patients. And so that is really important, is that knowing how to take care of these more intense patients that are coming in. And then you have, I wouldn't say less nurses, but, you know, you don't have maybe an ample amount of nurses. And so, you know, you're having to have four patients by yourself on a 12-hour shift, and they all have four different disorders and four different needs and 20 different labs. And, you know, so it's very intense, and it's very, very wide range of knowledge. And so you have to know how to manage that and how to be a hard worker during that time. So I think, and being organized, if you're not organized, we've been have been taught this, and like, have been stressed like to us, like you have got to be organized. And so I cannot stress that enough to y'all to be organized. Now, if you start now and you start practicing, it's going to be a lot easier for when you get into nursing school. And so I think that's really important. So, was there anything you did in high school that you feel excellently prepared for, that you feel prepared you for the field of work you are currently pursuing? Yes, 100%. Miss Haynes class. There's just nothing like being in a clinical setting. You could read a textbook for days on days on days, but until you get into that clinical setting and you put your, not really, you can't, well, with Miss Haynes class, you can't really do hands-on, but even just seeing and being in that field is just really different and something else than just reading a textbook and watching, it's like, I will say I'm a very hands-on and visual learner. So for me, I learn best with like doing and watching. And so for me, I learned a lot and gained a lot from that experience. And we actually just got our clinical placements. So I'm going to be in the cardiac unit in Dothan, Alabama. So I will have to travel, but that's okay. So I'm really excited about that. And for me, I'm very excited because I learn and I remember and I engage so much more when I'm in person, doing hands-on, learning by my mistakes, watching somebody else. That's the way I learn best. So I think that has prepared me a lot, just kind of knowing what to look for from my senior year, being in the hospital, and then just getting all the experience that you can. Because like I said, you could do textbooks, but until you get into the clinical field and you're in the clinical field for many years, you really aren't going to be an expert in nursing until you spend that time hands-on with your patients. So, how financially feasible is studying to become a nurse? How much schooling does it require? So, nursing school for the I'm in the BSN program to become an RN. So that's Bachelor of Science of Nursing for a registered nurse. And that's a 4.5-year program. So I did my 2 years already. I'm in right now. So I still have 2.5 years, a little less than 2.5 years, and then I'll graduate. So that will be my BSN RN, and then you have to take the NCLEX and pass that. And also you'll have to take these, like, I believe they're called, like progression exams. I don't know the exact term for them, but you have to take those each semester so you can progress to the next semester. So you can't just like learn everything and then like forget it. So that way, like it prepares you to keep going and to keep using the material you use, because nursing is all just like a building block. And so if you don't have those fundamentals that you learn in first semester, you'll struggle throughout the rest of the nursing school. So that's a 4.5-year program. Now I know there's an ASN program that Troy offers in Montgomery, and that is I believe a 2-year program, maybe 2.5. I'm not exactly sure, but that is just like getting into, like, you're in nursing school, you still have to apply, you still have to go GPA and everything, but you're just in there and you kind of learn the basics of the skills. With like a BSN program, you learn why, like the why behind what you're doing, and the research behind what you're doing. So like ASN, you learn to put in a Foley catheter, but like for BSN, now I don't know like the exact details of it, but like for an example, I would say like ASN, you learn how to put in a Foley catheter, but for like BSN, you learn to put in a Foley catheter and you learn the science behind why you were doing this, like in what situations could arise of why you need to put in a catheter. So that's a difference. I think there's a pay grade difference. I'm not sure how much of a difference, but either way, they're both great programs. It just kind of depends on your personal preference of what you want to go through. The BSN program here is great, and I really have enjoyed learning the why behind everything, and I think that will help me become a more well-rounded nurse. So I think that's it. If y'all have any more questions or need anything, need help applying, I encourage you to check out Troy University. I have loved it. I would have never thought about Troy University. I had no idea where Troy University even was when my parents brought it up to me, but I'm so glad they did. I came down here. If y'all want a tour, let me know. I can set y'all up with that. We have a couple games coming up, so just let me know. I would love for y'all to come down here and check it out. A lot of people don't know about Troy from Huntsville or decide to go to Troy, but it really has become a home away from home. I spend more time here than I do in Huntsville now, and I love it. I've met people. If y'all would have said that I would be here right now in nursing school, a junior in college, when I was in Miss Hand's class, I would have said, you're crazy. Like, I was literally looking forward to this day. So just enjoy your time while you have it. Don't try to rush it. It'll all work out. But if y'all have any questions or need anything about ACT, about applying to colleges, or just any questions in general about nursing or the curriculum or anything like that, let me know. Miss Hand has my phone number and my email. But yeah, that's it. So good luck with your senior year or junior year or sophomore. I don't know what grades are in this. But good luck. Study hard. It will pay off. It goes by fast, so enjoy every moment. And yeah, so see y'all later.